I'm Jenny Matthews. I'm one of the nurses here at Mount Laurel Animal Hospital, and very often I end up doing diabetic trainings with the newly diagnosed diabetic pets and their families. So I just wanted to talk to you a little bit about diabetes, what it is, and what is happening in your pet's body when you get a diagnosis like this. Diabetes, just so you know, has a learning curve, and managing this disease, is a process. So it's going to seem very overwhelming in the beginning, but I promise as you go through it with your pets, it will eventually just be something that you do and that you don't even really think about. So to start off, diabetes is what happens when there's not enough insulin, or the pet has insulin but the body's not using it, or they're not producing enough. So when we eat food and when your pets eat their food, it gets broken down into glucose, and glucose is the primary food source for the cells in the body, and they need this. So when we eat, a normal animal or a normal person, when they eat, you get a hormone release called insulin, and insulin is like a key, and it opens up the cells so that the glucose can go in and the cells can get the nourishment that they need. In the case of diabetes, there's no key, so there's no insulin, facilitating the movement of the glucose into the cells. So all that sugar just sits in the blood and does not so great things. One of the things that happens is that as the sugar moves through the body and it gets over to the kidneys filter out glucose for the cells. They know to do this. But when there's so much sugar, it spills over into the bladder, and sugar pulls the water. So sugar pulls water, and so all the water is going with the sugar, and that is why you are seeing an increase in urination and then an increase in drinking. It is because they are urinating out all of this water and sugar. The other thing that can happen is that if you have a lot of sugar in your bladder, it becomes like the perfect incubator for bacteria. Bacteria love sugar, and they will come and flock right to the bladder, and your pet will get a UTI. Oftentimes when a pet is initially diagnosed with diabetes, they already have a UTI. So this is already going on. So that's why if they ask you for a urine culture, or your vet wants to do that, that's the reason. The other things that sugar does that is not so great when it's not being utilized by the cells, it can cause a lot of damage to your pet's teeth, damage to their eyes, and of course damage to their kidneys. So it's a disease that you want to get under control and manage. The other big thing, besides the increased urination and increased drinking, they also, having a high blood sugar makes you hungry. So a lot of these pets, they think they're starving because their body is not getting the glucose that it needs. So they're eating everything. They're eating all their food, they're eating the other pet's food, they're stealing food from their humans oftentimes because they legitimately think they're hungry. And if they've been diabetic for a while and no one has caught it, the other thing that happens is because the body thinks it's starving, it starts to burn fat. And we can all do this. It's a survival mechanism, so we can burn fat for a short period of time when we're not getting the nutrients that we need. But if you burn it for too long, it produces a byproduct called ketones, and ketones are bad. So the blood can become very acidic, and the electrolytes go completely out of whack. It is a medical emergency. Oftentimes, the way pet families know that their pet has diabetes is it comes in a DKA situation. So ketones, they make the blood toxic to the pet. So it is a serious situation that requires at least like a 3 to 4 day hospitalization to stabilize everything. And the main symptoms of diabetes are excessive drinking, excessive urination, excessive hunger, and weight loss. So the pet who has been diabetic for a while and has ketones will be losing weight. So oftentimes that's another reason that people bring their pets in. And don't be upset if you didn't notice. the signs of diabetes. If you don't really know about diabetes, like, you wouldn't necessarily know the signs either. So, the important thing is that you got it caught now, and learn how to manage the disease so that your pet can continue to live, their best life.